Okay, so like we said, today we will attempt to close the chapter on the endocrine system anatomy. Okay, after today, we are going to focus on either reproductive system anatomy or nervous system anatomy. Okay, yes. So the endocrine system anatomy. Previously, we've learned that the endocrine system is a system that is made up of glands and some other organs that are not necessarily, endocrine champion organs. Their primary functions are not endocrine, but because of the fact that they obey endocrine principle, we classify them as endocrine organs. So the endocrine system is made up of glands. Is that okay? And then it's also made up of other organs that perform endocrine roles. Okay, and basically these glands and organs produces hormones, or some of them produces other chemicals, okay, that have to travel through the bloodstream before they reach their target organs. Okay, and all of these hormones and all of these gland activities contribute to regulating several processes in order for your body to function properly. Is that okay? And we also learned that when it comes to endocrine system organs in the endocrine system, they are not like organs in other systems that you see them located or being positioned in specific places. Endocrine system organs are distributed throughout your body. So we have endocrine system organs. For example, the hypothalamus is in your head. We have the thymus, the thyroid gland, all of them. The thyroid gland, the parathyroid gland, all of them at your neck region. Okay, we have in your abdominal area, we have the adrenal glands over there. Okay, when we go to your pelvic cavity, we have the gonads over there. Okay, so this tells you that endocrine organs are distributed throughout your body. Is that okay? We also learned the characteristics, the general characteristics of endocrine system. Okay, endocrine system is one of the characteristics is that it ductless. Okay, when we say ductless, what does it mean? Who have an idea? When we say one characteristic of endocrine organs is that they are ductless, what does it mean?
Sir, please, it means that it does not
We say
pass
about that.
through. Yes.
Yes, what
Sir,
did we say
hello.
about that? Yes, go
So
ahead.
we
We are
said
listening.
that we said that it almost doesn't pass through anything but passes through a bloodstream.
Good. So it hormones before they reach their target organs. They do not have to pass through any duct or tube before they reach their target organs. Okay, their hormones are released into the blood before they get to their target organs. And endocrine organs are also highly vascularized because they have to release or secrete their hormones into blood before they get to their target organs. There is a need for blood vessels to be closer to endocrine organs. Okay, so a lot of endocrine organs are highly vascularized. They have a lot of blood vessels around them. Is that okay? Great. Then we also learned that endocrine system organs are target specific. When we say target specific, what we mean is that endocrine organs, they secrete hormones. The hormones have specific cells they have to target, or the hormones have specific cells that either than that, there will be coas in the body. Imagine that every hormone produced by every endocrine organ, okay, all cells in your body are receptive to that hormone. In fact, there will be coas. Okay, there will be coas and confusion among your body cells. So endocrine organs are target specific, meaning when they secrete their hormones or chemicals, the chemicals target specific cells or tissues. Is that okay? And not necessarily having to influence all other cells in the body. Okay, that is what we mean by target specific. Okay, and we also learned that this system is one of the systems very slow. Okay, when it comes to how they go about their processes, they are very slow, but whatever is done by the endocrine system lasts longer. Okay, they are slow but long lasting. That is one character of the endocrine system. So generally, the characteristics of the endocrine system organs, they are ductless, they are highly vascularized, they are target specific, they are slow but longer lasting. Is that okay? Great. And we also came to learn about the endocrine types of signaling in the body. How many types of signaling did we talk about? How many types of signaling do we have?
Three.
Good. We have 3 types of signaling. Can you mention them?
Autocrine signaling.
Good. Autocrine signaling. Yes, that's the first. The second, paracrine signaling. Yes. Then the third.
Endocrine signaling.
Okay. So who will explain what is an autocrine signaling? Yes. What is an autocrine signaling?
You told her. I didn't tell her anything. She already knows.
Yes.
Autocrine signaling is a type of signaling
Signaling is when
where a gland
hormones, and it has the same receptors to receive the hormones that it releases. That's autocrine signaling.
It's incomplete. Come again. I told you when you're explaining, try and bring the concept of blood vessel inside.
Yeah, it doesn't
blood vessel. Autocrine signaling is okay.
Good. Yes, excellent. So now that you've corrected yourself. So remember, when you are defining paracrine signaling, try and introduce the concept of the blood vessel. That is what will make your explanation complete. So when you're explaining paracrine, this is a type of signaling where the chemical has its receptors on the surface of an adjacent cell. But before the chemical gets to the adjacent cell, that is the target cell, it will not pass through the blood vessel. You have to introduce the concept of the blood vessel. Okay. Autocrine signaling. A particular cell is releasing a chemical. Okay. The same cell has receptors for that chemical. Before the chemical the same cell is releasing for itself gets to itself, okay, it does not pass through the blood vessel. That is autocrine. Okay, then we come to endocrine signaling. Is that okay? What is an endocrine signaling? How does it occur?
It releases its chemical that by passing through the bloodstream.
Oh, come again. Organize your points well.
It's a signaling that releases its chemicals.
You have to introduce the concept of cell. You can't define signaling without mentioning cell.
It's a cell that releases its chemical by passing through the bloodstream.
No, it's still incomplete.
See.
Yes, who wants to help?
Me.
So
Okay, go ahead. We are listening. Go ahead.
It's a type of signaling that occurs when a cell produces
Okay. This is excellent explanation of endocrine signaling. Yes, you can't define signaling without mentioning cell. The definition would be incomplete. Is that okay? Yes. So endocrine signaling. In endocrine signaling, there are 2 cells. One is the cell producing the hormone or the chemical. The other one is the adjacent cell that has the receptors on its surface for the chemical. But then before the cell that is producing the chemical, okay, before the chemical reaches the target cell, it has to go through the blood vessel. In your explanation of signaling, if you fail to mention the word cell, it's incomplete. Okay, and even when you are even talking about paracrine signaling, if you fail to talk about 2 cells, it's also incomplete. So when you're explaining paracrine signaling, you have to mention that there are 2 cells. One cell is producing the chemical, but the chemical is an adjacent cell that has the receptors for the chemical. Before the chemical gets to the adjacent cell, it will not pass through the bloodstream. Paracrine. Okay. Endocrine. There are 2 cells involved in endocrine signaling. One cell is the cell producing the chemical. Okay. And then the receptors for that chemical is on an adjacent cell. But before the chemical gets to the adjacent cell, it has to pass through the bloodstream. You see, in the explanation, we are talking of two cells. Okay, so when you're explaining endocrine, don't just say that the chemical is, no, you should talk about the two cells. Other than that, you are not talking about signaling. Okay, because signaling is about communication. In communication, there are two cells involved. Okay, but we also mentioned that we can have another form of signaling where another form of endocrine signal. A cell produces a chemical. The same cell has receptors for that chemical. But before that same cell, the chemical comes to it, that one too goes through the bloodstream. That one too is endocrine. Do you remember that? Yes, do you remember?
Yes.
Good. And that is an example over here. So look at this. You see, we have two cells over here. You see the same color. The color should help you to understand the diagram. You see, we have the same color over here. So cell A. This one too is the same cell AO. So you see, signaling cell. This is the same cell. So it's like the same cell has receptors for the chemical that the same cell is producing. But the beauty is that before that same cell, the chemical it is producing by itself comes to work on itself, it still enters the blood before it comes. Once it happens that way, that is the principle of endocrine. If someone asks you principle of endocrine, the principle of endocrine is that a certain cell is producing a chemical. Before the chemical gets to its target, even if that same cell is the target, it has to enter the bloodstream before it gets to the target. That is the principle of endocrine system. Okay, and that is why, so if you hear of any organ or gland in the body, that gland produces either a hormone or a chemical, and before that chemical gets to where it is supposed to work, it has to pass through the blood. Automatically, that organ or gland we are talking about is an endocrine organ. Okay, and that is why we have several other organs that are not major organs being classified also and in the endocrine system. Is that okay? Great. Then we started looking at some of the endocrine organs. Okay, so we looked at the major endocrine organs. What are the major endocrine organs? Yes. Please mention the major endocrine organs.
Hypothalamus.
Yes.
Thymus.
Yes.
Thymus.
Thymus. Thyroid.
Parathyroid gland.
Parathyroid.
Adrenal gland.
Thymus.
Pancreas.
Okay.
Ovaries.
All right.
Testis and
Testis
thymus.
Pancreas.
and thymus.
Thymus.
Okay. Let's mention them for the second time. The major endocrine organs.
Hypothalamus.
Okay.
Pituitary
Gland.
Okay. That is
Pineal
fine.
gland.
thyroid gland,
Thyroid gland.
Okay.
Adrenal gland, thyroid,
Parathyroid
ovaries,
gland.
pancreas.
Adrenal gland.
Adrenal,
Pancreas.
parathyroid, thyroid, thymus.
Ovaries. Testis and
thymus.
thymus.
Hey, that one need of a test.
Yes. Excellent. Yes. That is great. That is great. Yes. So these are the major endocrine organs. Is that okay? But what is the difference between major endocrine organs and other endocrine organs? What is the difference between major endocrine organs and other endocrine organs?
So for major endocrine organs, their main function is endocrine.
Is to pass
But
through
for
the
the
Good.
other
Their
blood.
primary
ones,
function is endocrine. Yes. How about the other
but for
endocrine?
the other ones, they have their own primary function, but as part of their function, you also pass maybe certain
They obey the law.
chemicals through the bloodstream, which is
Good.
endocrine.
Excellent. Yes. Good. One way or the other, they also produce certain chemicals that before they get to their targets, they pass through the bloodstream.
They have
That
to
is
do
other endocrine organs. Is that okay? Yes. So the major endocrine organs, like we mentioned, we have the hypothalamus, we have the pituitary gland, the pineal gland, the thyroid gland, the parathyroid gland, the adrenal glands, the pancreas, the ovaries, the testis, and then the thymus. Is that okay? Where is the hypothalamus located? Yes, what's the location of the hypothalamus? Yes, the hypothalamus. Where is it? In the brain.
In the
The
brain.
pituitary gland. Where is the pituitary gland located?
The base
Base
of
of
the
the
brain.
brain.
Also in the base of the brain. The pineal gland. Where is it located?
The
Deep
Deep in
in
the
the brain.
brain.
Deep inside the
brain.
brain. The thyroid gland. Where is it located?
Behind the thyroid.
Behind the thyroid. Okay. All right. No. Behind the thyroid is the parathyroid gland. Yes. So the thyroid gland is in front of the
In front of
anterior
the
fold.
subclavian.
All right. That is fine. Adrenal glands. Where are they located? Adrenal glands. Good.
They are
They sit on
located
About
top of the
behind
kidney.
the
kidneys, above the
kidneys.
kidneys. All right. The pancreas. Where are the pancreas located?
Behind
Behind
the
the
stomach.
Behind the
Behind the
stomach. The ovaries. Where are the ovaries located?
Pelvic cavity.
Pelvic cavity.
Within the pelvic cavity. The testis. Where is the testis located?
Scrotum.
The
Within the
scrotum.
scrotum. And then thymus. Where can we locate thymus? Yes.
Upper
Where
chest.
can we locate thymus?
Upper chest.
Good. Upper chest. Excellent. Yes. So so that is it for the major endocrine organs. At least you should know the location. Okay. The location of the organs are also examinable areas. Okay. The location of the major endocrine organs. So for example, we can quiz you to find out if you know the location of the hypothalamus, the location of the pituitary gland. And these are things that we can use to do matching questions. Okay, so we can line up all the major endocrine organs. Then we also wrongly line up their locations. Then we ask you to do the correct matching. Is that okay? Yeah, so the hypothalamus, you should know is within the brain. Pituitary gland, you should know is within the base of the brain. The pineal gland is deep inside the brain. The thyroid gland is in front of the neck, the anterior neck. The parathyroid glands are behind the thyroid glands. Okay, the adrenal glands are also on top of the kidneys. We have the pancreas, okay, which is behind the stomach. The ovaries, the testes, and then the thymus. Is that okay? Yes. Again, so quickly, let's look at the other endocrine organs. Yes, what are the other endocrine organs?
Stomach.
The stomach. Yes.
The
Liver.
liver,
The
the
liver.
heart, the kidney,
Adipose
the adipose
tissues.
tissue, the
Adipose tissues.
placenta.
Great. Yes. So these are the other endocrine organs. So the skin, the liver, the heart, the kidneys, adipose tissues, placenta, and gastrointestinal tract. Okay. Over here, for the other endocrine organs, the area of interest should be that you should know what specific chemicals or hormones they produce. Okay. Not necessarily their location. Okay. Because you see, these are not major endocrine organs. So here, we expect that because here, the interest in literature is about what is making them endocrine. And that has got to do with the chemical they secrete into the blood. Okay, so for the skin, what do they produce? Okay, cholecalciferol, you should know. Cholecalciferol, which is vitamin D3 precursor, is secreted into the blood. So you should know. The liver, what chemical does it secrete? Is that okay? Insulin-like growth factor 1, you should know. IGF-1, you should know. And then angiotensinogen. If you remember the RAS system, is that okay? Then the heart produces the atrial natriuretic peptide and then the brain natriuretic peptide. The kidney also produces erythropoietin, renin, and calcitrol. And you know, all these chemicals, before they go and work, are released into the blood before. Okay, then we have adipose tissues. They produce leptin. Okay, then we have the placenta. Placenta produces the human chorionic gonadotropin. Okay, it also produces some amount of estrogen and progesterone. Okay, then we have the gastrointestinal tract. Okay, so the gastrointestinal tract, you know, hormones like, or chemicals like the gastrin, secretin, cholecystokinin. These are all chemicals that before they work, they are released into the bloodstream. Okay, so for the other endocrine organs, areas that I can focus to ask you questions on is on the chemical of the hormone that they produce. Okay, so we can line up the other endocrine organ on one side, then we line up the hormone, we mess them up wrongly, then you will do matching for the chemicals, okay, or the hormones that they produce. Okay, yeah, so that is it for major endocrine organs, and then other endocrine or minor endocrine organs. And then we started looking at the main, the boss in the endocrine system, the hypothalamus. Yes. What is another name for the hypothalamus?
Master regulation.
The master regulator, or you can also call it the head ganglion. Okay, that's the master regulator, or you can call it what? The head ganglion. Okay. In fact, let's go straight to the point. For the hypothalamus, your interest should be appreciate the fact that, okay, this is a very small gland. Okay, in fact, the hypothalamus is not even considered as a gland. It's an organ on its own. Okay, the hypothalamus is an organ on its own. That is why we do not want you to call it a master gland. That is why the pituitary gland is rather the master gland, because the hypothalamus is an organ on its own. Just that it plays a major endocrine role. Okay, so because of that, we consider it as the master regulator. Is that okay? We call it the master regulator. The master gland is the pituitary gland. Okay, now it's the master regulator, but it's a very small organ. Very, very, very small. Is that okay? Now here, anatomically, you have to know the shape. This organ is almond-sized shaped. That's the shape of the hypothalamus. Okay, now let's look at the size. Okay, look at the size. It accounts for less than 1% of the total brain mass. Can you imagine that? Look at the entire brain mass. The entire brain mass, if you are looking at it 100%, the hypothalamus, looking at how big its function is, the size is very small, less than 1% of the total brain mass. Okay, but then despite the size being small, the hypothalamus plays a very crucial role in regulating all vital body activities. Is that okay? It's very small. So the other time I told you in class that when it comes to anatomy and we are looking at organs, do not judge a book by its cover. Okay, and it works over here. Hypothalamus is a very small, very, very small in terms of its size. Is that okay? And even if you look at the endocrine system, it's one of the smallest organs. Okay, compared to organs like the thyroid gland. The thyroid gland is the largest organ in the endocrine system. Okay, but looking at the hypothalamus, how small it is, the hypothalamus is even, its functions are even more crucial than the thyroid gland, because it's bigger than the thyroid gland in terms of its functions. And that tells you how crucial this organ is. Okay, we also learned something unique, or some characteristics of the hypothalamus. And we came across the fact that this gland or organ does not communicate to any other gland directly apart from the pituitary gland. Do you remember that? Do you remember this gland? It only communicates with the pituitary gland. Yes. So this is a gland that only communicates with the pituitary gland. Okay. It communicates to the pituitary gland. This is the only gland that this organ communicates with, the pituitary gland. So if we ask you a question and we tell you that the hypothalamus communicates to any other gland, it's wrong. This organ only communicates with the pituitary gland. But the question is that how does it communicate with the pituitary gland? Because we also learned that the pituitary gland is having two anatomical divisions. What are the two anatomical divisions of the pituitary gland? Yes, what did we say?
The anterior and the posterior.
Good. The anterior pituitary and then the posterior pituitary. So now the question will be that, okay, how does the hypothalamus communicate with the anterior pituitary? 2, how does the hypothalamus communicate with the anterior pituitary? Yes, who remembers?
It communicates with the anterior pituitary through the hypophyseal portal system, which is through the blood vessels.
Through a blood vessel, yes. And then how about the posterior pituitary?
It communicates with the posterior pituitary through the hypothalamus hypophyseal tract, through the
Good.
nerves.
Which is a nerve transport. So when we ask you, I like how you've answered the question. So in exams, when we ask you how does hypothalamus communicate with posterior pituitary, you go and write nerves. It's wrong. Go. Keep it in your mind. If you go and write nerves, it's wrong. In fact, I may consider deducting you extra marks. You have to say that it communicates to the posterior pituitary through the hypothalamo-hypophyseal tract, which is made up of nerves. Just as the young lady answered the question, very brilliant submission. When we ask you how does the hypothalamus communicate with anterior, don't go and write blood vessel. It's wrong. How does the hypothalamus communicate with the anterior pituitary? Through the hypophyseal portal system, which is made up of blood vessels. Then you add that, oh, that transport system is via what? Blood vessels. Is that okay? Yes. So this gland is very small. In summary, this is the master regulator. Why is it a master regulator? It's a master regulator because, and take note, this is a very interesting critical thinking question. I can ask you in exams, why is the hypothalamus the master regulator? Then I'll put 30 marks there. Okay, in the anatomy of the endocrine system, why is the hypothalamus considered the master regulator? How will you answer this question? Yes, who want to try? Yes, if we ask you this question in exam.
Signals between both the nerves and then the endocrine system.
Okay, that is one. Any more? Any more points?
Sir, please, because it regulates everything that happens in the endocrine system.
Okay, you see, I just don't want you people to be just, people who just pass anatomy. I want you to be people who really understand anatomy. And so when you are communicating, I want to see that kind of detailed understanding in your communication. You get so, and I appreciate the answers you are giving. The answers you are giving really shows you understand what you are talking about. But you can be more detailed. Okay, we ask you. Okay, the hypothalamus. You mentioned that it's sort of linking the pituitary gland to the other glands. That is brilliant. Is that okay? But add more details. Is that okay? Add more details. It's linking the pituitary gland to the other organs. That is excellent. But you should be able to tell us that, oh, the hypothalamus is a master regulator because even though it does not communicate directly to the subglands, it only communicates to the pituitary gland. But one way or the other, it influences activities in all the other glands. That shows that you have deeper understanding. Do you get it? So even though this gland, as small as it is, it does not communicate to the subglands directly. It only communicates with the pituitary gland. But it influences all the other glands, the activities in all the other glands. It tells you that this gland is having a lot of authority. So it's like someone in your class who does not talk to you, but the person can talk to someone to command you. That person is a boss. Someone like that is a senior. The person will not come to you and talk to you direct, but all the time the person's message comes to you. It tells you that person has some kind of authority. Okay, for the person to even be able to send someone to come and communicate and give you an instruction to do something, tells you the person have some kind of authority. And that is the nature of the hypothalamus. It will not go to the thyroid gland and talk, but it will communicate to the pituitary that go there and go and send my message. Okay, and it tells you this gland has some authority. That is why we've given it the master regulator. Is that okay? So the master regulator, your explanation should capture that word. It's a regulator because even though it does not communicate to all the other organs directly, but through its communication with the pituitary, it regulates all the other glands in the body. Do you get it? Then that tells that, no, you really understand what you are talking about. That is why we call it the master regulator. In the master regulator, no, on a gland be to say ovaries and kokasa. On a gland be to say thyroid gland and kokasa. But on the message, you have a pituitary, I'm a pituitary, the command na command. That tells you, and that is why it's the master regulator. Is that okay? That is why it's the master regulator. Okay, so it regulates the activities in all the other glands. Is that okay? Great, excellent. Yes, and then we also learned that it communicates to the pituitary gland. It communicates to the pituitary, which is divided pituitary gland, anterior pituitary, the posterior pituitary. Its communication with posterior is through nerves. Its communication with anterior is through what? Blood vessels. Okay, and the communication via blood vessel, we call that the hypophyseal portal system. Its communication with the posterior, we call it the hypothalamo-hypophyseal tract. Is that okay? Great. Now let's discuss this. Now the hypothalamus produces two types of hormones. Listen carefully. This point is very important to me. Hypothalamus no o produce hormones ahodoɔ mmienu. Unse yesua say hypothalamus no o produce ni hormones na hefa na eko pituitary gland ne ho. Let me take that again. Hypothalamus o produce ni hormones na hefa na eko pituitary gland ne ho. But don't say pituitary gland no mmienu. Inti mean say o produce hormones na definitely be pituitary posterior pituitary ne ho. Ebi nso be anterior pituitary ne ho. What I say? Now the anterior pituitary ne ho no famogem. Esan say no famogem no endocrine system no say organ be release bibi na famogem a ye ka say organ no ye use the word release. Say organ be release chemical na hormone. Na be famogem ansa na ko baby e kwa ye ka say organ wa release. But say organ be je bibi na say no na baby e be ko no famogem ansa na kwa ye be ka say organ no wato akoho and I say they've sent it there. Okay, so in physiology what we say is that the hypothalamus produces some hormones. Some of them they are released. The ones that are released, they enter the blood vessel, they go to the anterior pituitary, and two of them are also sent. Why are we using the word sent and not released? Those ones, they are going through a nerve fiber. So we use the word sent. Is that okay? So there we have two hormones from the hypothalamus that are being sent to the posterior pituitary. What are those two hormones? Yes, who remembers? What are the two hormones produced in the hypothalamus that are sent to the posterior pituitary?
Oxytocin and diuretic.
Oh, who is mentioning releasing and inhibiting hormones? We are talking about posterior pituitary.
So is
oxytocin and antidiuretic hormones.
The question we are mentioning is that we are saying the hypothalamus produces a certain hormone that are sent to the posterior pituitary. Those hormones are not releasing and inhibiting hormones. Is that okay? Great. So we call those hormones we call those hormones the posterior hormones. If you remember very well, I started by telling you that the hypothalamus produces two hormones. Hormones ne fi hypothalamus ne ho no. Ya chiche omumu mienu. First one ye friend posterior hormones. Posterior hormones ne hormones fi hypothalamus ne ho echo posterior pituitary. And ye wo anterior hormones. Anterior hormones no ne fi hypothalamus ne nchen echo anterior pituitary. Now anterior hormones ne ya chiche mu mienu. Anterior hormones ne ye wo releasing and ye wo inhibiting hormones. Fasha wa adwemu. Inti hypothalamus hormones no produce no ya chiche mu mienu. Then tin ya chiche mu mienu because ebi ko posterior pituitary, ebi nso ko anterior pituitary. Okay, the echo posterior pituitary no hormones if you hypothalamus ko posterior pituitary no ye from posterior hormones. Hormones ne fi hypothalamus echo anterior pituitary no ye from anterior hormones. Now sa anterior hormones no ya chiche omumu mienu. Ye were inhibiting hormones and you were releasing hormones. Is that okay? Keep that in your mind. Okay, but posterior hormones, no, they are not released. The reason why we do not use the word release for the posterior hormones, we use the word sent, is that we use release when they are being secreted into the blood vessel. But anterior hormones, no hormones, anterior pituitary, they are released. Why are we using release now? They are being transported to the anterior pituitary through the blood vessel. Is that okay? Yeah. So what are the releasing hormones? What are the releasing hormones that are produced in the hypothalamus? Yes, what are the releasing hormones?
We have the corticotropin releasing hormone.
That is fine.
We have the hyperthyroid pin. The high.
Then we have the corticotropin releasing hormone,
That is fine.
releasing hormone, growth hormone releasing hormone.
Okay.
Gonadotropin releasing hormones.
Come again.
Gonadotropin releasing hormones. And growth hormone releasing hormones.
Okay.
Growth hormone releasing hormones.
Growth hormones.
We still have one you've not mentioned. No one have mentioned the TRH. Which one is the TRH?
The thyroid.
That's the thyrotropin
releasing hormone.
Suyakan. Ochina biba be lecturer. Ochina be lecturer. Thyrotropin, say thyrotropin releasing hormone.
Thyrotropin releasing hormones.
Say it again. Say thyrotropin releasing hormone.
Thyrotropin releasing
hormone. So the releasing hormones, we have the thyrotropin releasing hormone, corticotropin releasing hormone, gonadotropin releasing hormone, growth hormone releasing hormone.
Thyrotropin releasing hormone.
Is that okay? Good. Corticotropin releasing hormone, gonadotropin releasing hormone, and growth hormone releasing hormone. How about the inhibiting hormones? Which ones are the inhibiting hormones?
Prolactin inhibiting hormone.
Excellent. Yes.
Hormone inhibiting hormone.
Growth hormone inhibiting hormone. Melanocyte stimulating inhibiting hormone.
Hey.
Okay, melanocyte stimulating inhibiting hormone. Is that okay? Now, when we say thyrotropin releasing hormone, say hypothalamus, yeah? Hypothalamus produce TRH, thyrotropin releasing hormone. Don't say releasing hormones, no. Hypothalamus need produce what? What if say hypothalamus will produce TRH? Ababa be ye and then a bema swat say a somatostatin. Anytime I obey somatostatin, a hormone bia say hormone bia costra and none of the neutralizing of somatostatin. Say you do pancreas. You could do pancreas. I will say pancreas and then special pancreas hormone bio produce bia or no as produce or no as somatostatin. Somatostatin in your hypothalamus and quan produce pancreas will produce an idea. Into pancreas, we will say pancreas has what we call the delta cells. The delta cells of the pancreas produces somatostatin. You can't somatostatin when endocrine system one. A hormone be as a hormone be a costra or no neutralizing. Into hypothalamus no the hormones no produce no or some produce hormone be a say hormone no produce ni be costra so hormone in neutralizing. That is how special this gland or organ is. Okay, that is what we call the somatostatin. But keep it in your mind. It's not only the hypothalamus that produces somatostatin. Pancreas also produces somatostatin. Okay, so somatostatin is just a neutralizing hormone. Is that okay? Okay, then we have the prolactin inhibiting hormone. That is what we call the dopamine. Okay, then we have the melanocyte stimulating inhibiting hormone. Now, say you can't releasing hormones, ne inhibiting hormones, ni boma. What is the name given to those hormones? The common name for the releasing and inhibiting hormones. I mentioned the name.
The anterior hormone.
Anterior hormones. So the hypothalamus produces two groups of hormones, anterior hormones and the posterior hormones. Anterior hormones na ya chiche mu mienu. Anterior hormones na ya were releasing hormones and ya san were inhibiting hormones. Okay, but posterior hormones na ya chiche mu. Is that okay? Why do we call it posterior hormones? Our hormones no hypothalamus ni produce now at home. No more call posterior pituitary or no ya store them. They store them there. Okay. Anterior hormones na hypothalamus no produce on to one call anterior pituitary or send or the one more family genuine sana ko intend no we release inter starting year juma crans and aqua could do anterior pituitary gland in chain into we release ya starting year juma but posterior hormones no on releasing ten starting year juma and free hypothalamus ebekwa could do posterior pituitary na posterior and mombe release and sana start year juma. That is the difference, so keep it in your mind. So if we ask you to mention hormones, so examine bisa say bo hormones are you release the free hypothalamus. Oko bo posterior hormones ne kan ho pe wati. But examine ne ka say bo hormones are you produce e hypothalamus no dia eno de obebo posterior hormones na san abo anterior no. So examine bisa say bobo hormones e produce hypothalamus ni mu a posterior hormones no e kan ho. Obebo posterior hormones na san abo anterior hormones. But examine ni bisa say bobo hormones e release the free hypothalamus o ko kan oxytocin ni ADH kan ho pe wati. They are not released. They are produced by the hypothalamus, but they are not released there. We can also ask you that, okay, make me bisa our exams, we say, bobo hormones they are produced by the hypothalamus, but they are not released from the hypothalamus. What will be your answer? Mention two hormones that are produced by the hypothalamus, but not released from the hypothalamus. What will be your answer?
Antidiuretic hormone and oxytocin.
Excellent. Antidiuretic hormones and oxytocin. Sansuna says some could be so say. To say a bizarre question, say, okay, antidiuretic hormone and oxytocin are produced in the posterior pituitary. True or false? What will be your answer?
True.
Hey, posterior pituitary. That is false.
False.
Yeah, that is false.
False.
Please, antidiuretic hormones and oxytocin, they are not produced in the posterior pituitary. They are stored there. They are produced in the hypothalamus and they are sent there to be stored. Keep it in your mind. Antidiuretic hormone and oxytocin, they are not produced in the posterior pituitary. They are stored there. They are produced in the hypothalamus and they are sent through the nerve fibers to the posterior pituitary to be stored there. Is that okay? Keep that in your mind. Is that okay? Great. So that is how the whole process works. Is that okay? So now let me use this table to show you something. To show you how. Anyway, I think I have. Yes, please. Yes, please. Go ahead and ask your question, please.
Sir, please. I don't really get. You said the anterior hormones.
Yes.
They are produced where?
All the anterior hormones are produced in the hypothalamus. All the posterior hormones are also produced in the hypothalamus.
Oh, okay. So
are we good now?
They are produced in the hypothalamus and they go through the blood vessel to the posterior pituitary.
Oh, no. The anterior hormones are... No, the posterior hormones are the ones that are produced in the hypothalamus and they go through the nerve fibers to the posterior pituitary. Don't say blood vessel. Once you use blood vessel, then you are talking about anterior hormones. Okay. Anterior hormones are produced in the hypothalamus. Posterior hormones are also produced in the hypothalamus. Yes, the hypothalamus no produce anterior hormones now. Or the omo famogem, no the omo call anterior pituitary neho. So produce posterior hormones mienu na oxytocin, any ADH. Then no the omo fan nerve fibers in. No the omo call posterior pituitary no. No I call store omo. But who say anterior hormones no so produce no the omo call anterior pituitary. Yet so the omo call store. Almost started year juma. It's a difference na say. In the anterior hormones, they're releasing and inhibiting hormones. So the hypothalamus need produce Ne o release good blood vessel no more anterior pituitary no ha. Omo nko for them to be stored o. Omo starting ye juma and san omo ko. Until you use the word release.
Okay.
But posterior hormones ne so produce no more ko posterior pituitary no ha o release o produce omo ye juma or two omo ko. What have you gotten the picture?
Yes.
Have you gotten the picture?
Mm.
Good. So hypothalamus ni produce anterior hormones, posterior hormones. Anterior hormones ni so produce onwa release. Say e ka so onwa release e mean say wajai wo mama fi hypothalamus ho no omo ye adwuma deda. But posterior hormones ni so produce on release meaning say enyo no no be hye wo mama o ye adwuma. Or two omo do omo posterior pituitary ti posterior mom and a best na me na ye adwuma. Nti say examiners will be say which gland releases oxytocin and ADH? What will be your answer? Which gland releases oxytocin and ADH? What will be your answer?
The
Pituitary gland.
It's not pituitary gland. Check your answer well.
The posterior
It's the posterior pituitary gland. Che anatomy diku tiase. Is the posterior pituitary gland. See, beside say gland ben into you say yes, say hypothalamus no or produce hormones me no anterior hormones, posterior hormones. Anterior hormones then the attitude me no inhibiting and releasing. Anterior hormones no produce or no jai or mo ye juma. What I say on two or more anterior I'm anterior mum enjai or mo. But posterior hormones ne so produce or no anja or mo ye juma or two or more posterior ni mum ne be jai na ye juma. What's the one I say? I'm trying to break it down, complex things down for you to get it. Do you get it? So in the bisa will say, which gland releases oxytocin and ADH and your hypothalamus? A posterior pituitary not release you. But the bisa say which gland produces ADH and oxytocin and none an answer near hypothalamus. Is that any bisa will say which gland releases thyrotropin releasing hormone? What will be your answer? Which gland releases
anterior
thyrotropin?
pituitary gland.
Hey, which gland releases thyrotropin? Thyrotropin releasing hormone.
The hypothalamus.
Hypothalamus. Tiasie. Besides, which gland releases TRH and on a hypothalamus? Okay. Hypothalamus on one releasing idea. I know on toma omo. On toma anterior pituitary on no one kasa or releasing idea fee. Okay. Besides, so what that means is that listen, what that means is that the hypothalamus produces and releases the TRH by itself. When it comes to the oxytocin, it produces, but it does not release. The same way when we talk of ADH, the hypothalamus produces ADH, but it does not release it. They are sent to the posterior pituitary. It's the posterior that rather releases them. Is that okay? Now let's come to another hormone, corticotropin releasing hormone. Which gland releases corticotropin releasing hormone?
The hypothalamus.
The hypothalamus. Is that okay? Okay, which gland produces corticotropin releasing hormone? Which gland produces the corticotropic releasing hormone?
The hypothalamus.
The same hypothalamus. Okay, which gland produces gonadotropin releasing hormone?
The hypothalamus.
Excellent. Which gland releases gonadotropin releasing hormone?
The hypothalamus.
Which gland releases oxytocin? That your mind is here. Now that your mind is in anatomy. Is that okay? Which gland produces prolactin inhibiting hormone?
The hypothalamus.
Hypothalamus. Okay. Which gland releases ADH?
The
Posterior pituitary.
Produces and release corticotropin releasing hormone?
hypothalamus.
Hypothalamus.
Hypothalamus. Okay. Which gland produces and releases growth hormone releasing hormone?
The
The
hypothalamus.
hypothalamus.
Okay. So now listen to this question and tell me whether you go in for true or false. The hypothalamus produces and releases oxytocin. True or false?
False.
False.
False. Yes. Who said true? Who's the one saying true there? Okay. The next question. The hypothalamus produces and releases growth hormone releasing hormone. True or false?
True.
Good. The answer is true. Okay. The hypothalamus produces and releases ADH. True or false?
False.
False.
Why can't true achieve honor? Okay. The hypothalamus produces and sends oxytocin. True or false?
True.
Yes, this one is true. This one shows that now the mind is now home. Yes, the mind is now home. Is that okay? Yes. So that is it for that. Yes, please ask a question.
So please, in summary, with per my understanding, that means that the hypothalamus produces and releases all the anterior hormones.
Excellent. That is a summary. Okay. That is a great understanding. So it produces and releases, and not just say, I mean, you see, we find an example. I quite to say, oh papa, oh father, I thought fan amount. On one so fan, not the amount of school now I saw. You decide say, why is so fan now? What will be your answer?
Ayo.
Now was so fan. What was school now? When I was so fan. That's the synergy over here. So that is the posterior pituitary. In the hypothalamus to produce oxytocin, and your one is so. Automa posterior pituitary, ni posterior muma so. The so now me use to and then you release. Is that okay? Yeah. So when the hypothalamus produces the posterior hormones, it does not release them. On one so meaning say on one juma. Or the back posterior pituitary, no, posterior pituitary na best so hormone na mana juma. On a be releasing hormone, no, amana juma. Is that okay? Yeah. So basically, that is it for there. Yeah. So again, so you see that when the hypothalamus produces the anterior hormones, where are they going? They are going to the anterior pituitary. When the hypothalamus produces the posterior hormones, where are they going to? They are going to the posterior pituitary. Now, learn this thing. To see the hypothalamus produces the anterior hormones. They are going to the anterior pituitary. What does it mean? When say a endocrine system, or target specific. What does it tell you? As a child say, and your hormones na hypothalamus ni producing a anterior pituitary on excess anterior pituitary no cells be almost all receptors for that hormone. Now when we enter the anterior pituitary, we have some cells there. When we enter the anterior pituitary, we have some cells there. Now we have the thyrotroph cells, we have the corticotroph cells, we have the gonadotroph cells, we have the somatotroph cells. We also have another somatotroph cells. We have lactotroph cells. We have the melanotroph cells. Is that okay? Into radio, hypothalamus will produce thyrotropin releasing hormone. And if an occur, yes. Where is he going to? Answer this question first. Yes, when the hypothalamus produces the thyrotropin releasing hormone, where is he going to?
Anterior pituitary.
Anterior pituitary. It releases them into the anterior pituitary.
It releases them into where?
The anterior pituitary.
Okay, that is fine. So it releases them into the anterior pituitary. Say, hormone so anterior pituitary where? Anterior pituitary, yes, so cells be brio. Cells, your 1, 2, 3, 4, 5, 6. There was 6 cells. Cells, mako 6. And one anterior pituitary. Into hypothalamus, so produce thyrotropin releasing hormone. No, anterior pituitary or kwa or kwakoshe obi a otene kasa. Obi obetumi atie ne kasa. Onipa otene cell na otene kasa o hon ye friend thyrotroph cell. Into the moment hypothalamus go produce thyrotropin releasing hormone. Or anterior pituitary where obekwa kwakoshe thyrotroph cells. No, I could catch thyrotroph cells and they say, oh, boss say, oh, that do. Starting a year juma. Ubon say into a cast thyrotroph cells, and not thyrotroph cells, and that's what started. No produce TSH. Okay. Second one, hypothalamus or some produce corticotropin releasing hormone now. And if I know anterior pituitary no. Or anterior pituitary no, uncle anterior pituitary can see any now. Or cost specifically or conscious cell or tenecasa. Cell or one anterior pituitary more say corticotropin releasing hormone necasa. Your friend corticotroph cells. No, I could catch corticotroph cells in the patch. Boss say, oh, that do start a year juma. Ubos on no swat start, no swat produce ACTH. Hypothalamus now so let's produce gonadotropin releasing hormone. So produce gonadotropin releasing hormone now. Or call anterior pituitary. Or call anterior pituitary where on share thyrotroph cell. On share corticotroph cells. Or bekwa share gonadotroph cells. So share gonadotroph cell. No, I catch and say, oh, boss say all rest. Start na year juma. After na gonadotroph cell na one anterior pituitary mono. Or no swat start no produce FSH and LH. That is how it works. Okay. Now, hypothalamus now soon as produce growth hormone releasing hormone. So produce growth hormone releasing hormone now. On also anterior pituitary. Or anterior pituitary on share thyrotroph cell. On share corticotroph cell. On share gonadotroph cell. Or bekwa share somatotroph cell. No, I catch there no. Somatotroph cell boss cell order into start na year juma. Na somatotroph cell no. On also produce growth hormone. The same thing. Hypothalamus now so they produce growth hormone inhibiting hormone. So produce growth hormone inhibiting hormone on also the anterior pituitary no or anterior pituitary or because catch this time no inhibiting hormone. Into we catch but growth hormone inhibiting hormone no best share the same somatotroph cell. No I catch and say boss say oh yeah juma to do. Inhibiting hormones they give a negative command. Because the boss say, oh, yeah, demand to relax. Tubos on no bad day, obey produce an inhibiting hormone for the growth hormone. Send a bear growth hormone in the bathroom. Okay. The same hypothalamus produces the melanocyte stimulating inhibiting hormone. Melanocyte stimulating inhibiting hormone a hefan or anterior pituitary in chain. But to do anterior pituitary where on share thyrotroph cell. On share corticotrophs, on share gonadotrophs, on share somatotrophs, obekwa share melanotrophs. Okay, no, I catch a melanotroph say, but it will depend. The melanotroph, it will either give it a positive message or a negative because it's a releasing and inhibiting hormone. Is that okay? It's a stimulating and inhibiting hormone at the same time. Indeed, that's what a command depending on the level of melanin in the skin. Or be man command so on your juma, and so be man command so on your unrelaxed. Okay. The same hypothalamus so it produces prolactin inhibiting hormone. So produce prolactin inhibiting hormone. Now anterior pituitary. On share thyrotroph cell. On share corticotroph cells. On share gonadotroph cells. On share somatotroph cells. Or bekwa share latotroph cells. Now I catch your latotroph cells in the cell. Boss say, oh yeah, juma do. boss say, oh yeah, you mad do. Remember, prolactin inhibiting hormone is an inhibiting hormone. So the negative feedback and a better command to 12 cells. Boss say, oh yeah, you mad do. Until relax it. So bed or very relaxed, so that it will inhibit prolactin release or prolactin secretion. Okay, keep that in your mind. But say hypothalamus will produce ADH no oxytocin. Omonomo anterior pituitary, omo cell be unchanged. Omonomo here cell, omonomo posterior pituitary ho straight, yeah, storm or now posterior pituitary no moment I bear or no, or be release those hormones. Is that so? The question I can ask you is that if the hypothalamus produces thyrotropin releasing hormone, what is a target cell in the anterior pituitary? What would be your answer? The thyrotroph cells in the anterior pituitary. Okay, another question I can ask you is that if the hypothalamus produces the corticotropin releasing hormone, what is a target cell in the anterior pituitary?
Corticotroph cells.
Corticotroph cells. Makes me so bizarre. Say the hypothalamus it produces gonadotropin releasing hormone. Or core anterior pituitary cell ben or beka sheshen wo. What will be your answer?
Gonadotroph cells.
Gonadotroph cells. Makes me so bizarre. Say hypothalamus will produce prolactin inhibiting hormone. Now core anterior pituitary cell or beka sheshen no. Your friend a thyrotroph cell. True or false? False. Okay, if it is false, what cell will you go and look for?
Large cells.
Make me so bizarre saying melanocyte stimulating inhibiting hormone. The hypothalamus a produce. Now upon anterior pituitary or bekwa kwhwehwe cell a friend melanotroph. True or false?
True.
The answer is true. Is that okay? The answer is true. Makes me so bizarre say hypothalamus a produce oxytocin or core anterior pituitary or bekwa kwhwehwe corticotroph cell. True or false?
False.
Why is it false?
It is false because the oxytocin does not go to the anterior, but it's rather stored in the posterior.
Excellent. This shows that you have a deeper understanding of the hypothalamus. Yes, excellent. Yes, this shows that you really understand. Yes, this shows that you really understand. Is that okay? Okay, that is fine. But please, if your background is a bit noisy, if you are not talking, you can mute yourself. When you are talking, then you're mute. Okay, that is fine. All right. So you see, it's very simple.
Yeah.
Yes, please. Yes, please.
Please, I want to ask a question.
Ask your question,
Assuming a child is growing too tall.
Too tall, okay.
Yeah. And does that mean that the child's growth hormone is working too much?
Good. It's a bit nyaba say akwalakono or cancer or hypothalamus ni. Ti say akwalano or cancer or hypothalamus ni mu a, the be seen say growth hormone releasing hormone no ebe kosro. Because say or cancer or hypothalamus means say cells na hypothalamus ba be brain. Into growth hormone releasing hormone no be kosro. Into say growth hormone releasing hormone because it means all the information be bekwa from somatotroph cells. Now somatotroph cells and so am a pituitary gland no I produce growth hormones be brain. And on a bema kola and I more tola. A bit means what say problem ni hypothalamus. A bit me say problem ni wo pituitary gland and ankasamu. Into pituitary gland ni produce somatotroph cells be brain. Fasha waji mu say somatotroph cells no produce growth hormone. Inti se obi or cancer or hypothalamus nim and also or cancer or pituitary gland nim that person can get that effect too. Is that so? It's two things. Either the person is having a problem in the hypothalamus or having a problem in the pituitary gland. Are we good?
Yes.
Please, are we good?
Yes.
That is fine. So now you know all the hormones produced in the hypothalamus. From this diagram to you would also know all the hormones produced in the pituitary. So this is how it goes. Hypothalamus, when I finish, I'll ask one of you to explain. Hypothalamus, it produces thyrotropin releasing hormone. When it gets to anterior pituitary, it will go and look for the thyrotroph cells. Then the thyrotroph cells in the anterior pituitary produces TSH. All that means is that one of the hormones produced by the anterior pituitary is the TSH, thyroid stimulating hormone. Now, when the hypothalamus produces corticotropin releasing hormone, it will go to the anterior pituitary. What cell will it go and look for? It will go and look for the corticotroph cells. Then the corticotroph cells will now produce ACTH, adrenocorticotropic hormone. The hypothalamus will produce gonadotropin releasing hormone. When it produces gonadotropin releasing hormone, it will go to the anterior pituitary. What cell will it go and look for? It will go and look for gonadotroph cell. Gonadotroph cell, it will go and look for gonadotroph cell and instruct gonadotroph cell to produce either follicle stimulating hormone or luteinizing hormone. Hypothalamus produces growth hormone releasing hormone. When it gets to the anterior pituitary, what cell will it go and look for? It will go and look for somatotroph cell. When it gets to the somatotroph cell, it will command it to produce what? Growth hormone. So it means that the anterior pituitary produces growth hormone. Hypothalamus also produces growth hormone inhibiting hormone. When it gets to the anterior pituitary, what cell is it going to look for? Somatotroph cells. When it gets to the somatotroph cell, what command? It will command it to stop producing growth hormone. Hypothalamus also produces prolactin inhibiting hormone. Where is it going to? Anterior pituitary. Which cell is it going to look for? It's going to look for latotroph cells. What instruction? It will tell the latotroph cells to inhibit prolactin release. Hypothalamus also produces the melanocyte stimulating inhibiting hormone. It will go to the anterior pituitary. What cell is it going to look for? It is going to look for the melanotrophs. Okay, what instruction is it going to give? It will either give a positive or a negative instruction. Okay, hypothalamus produces ADH and oxytocin. Those ones will not go to anterior pituitary. They will go to the posterior pituitary to be stored over there. So I can ask you a question that, okay, yes.
Is that a situation whereby two or more hormones can work at the same time, or they can be produced at the same time?
All hormones are working at the same time. It's not like thyrotropin, corticotroph, relaxing. They are all working at the same time, just that they all have different receptors. Is that okay? They are all working
you
at
made
the same
mention
time.
of the gonadotroph cells. When they go to the pituitary.
Good.
Two hormones are being produced. That is the follicle stimulating hormones and the luteinizing hormones.
Excellent.
So is it that they are being produced?
And don't forget
one after the other?
Gonadotropin releasing hormone. How a yen ejuma will make different. How a yen ejuma mamu different. Into say a fat or bar, say a fat or bar. So hypothalamus produce gonadotropin releasing hormone. Anterior pituitary gonadotrophs. Gonadotrophs may produce more of FSH. Now produce LH ne kakra. If it's a obano, ugonas no here FSH ne more for your menstrual cycle and reproduction. Is that okay? That is how that place works. Okay, don't forget that FSH no obano. If you FSH now, call ovaries. If you FSH one anterior pituitary now. FSH no echo ovaries. FSH no and echo commanding ovaries. Now mama produce estrogen progesterone. What I say. But say you bema, you hear more of the luteinizing hormone. Okay, and a bit of or some portion of the follicle stimulating hormone. Is that okay?
Yes, sir.
That is how it works. Okay, that is why that hormone who say two. To say a male gonad they be different. A female gonad then so be different. Is that okay? Please, are we good?
Yes, sir.
All right, excellent.
Sure.
Yeah. So, yes.
So I have a question.
Okay, ask your question, please.
So you meant that melanocyte stimulating inhibiting hormone stimulates the melanotrophs to either inhibit MSH or
patients kuna individual kuna ye kano melanocytes edoswa melanocyte inhibiting hormone be produce individual kuna ye kano melanocytes ni so a stimulating hormone no a joint hormone. Ni dino a boom melanocyte stimulating in and not just a producing melanocytes is inhibiting this stimulating the boom. Are you getting it? Into say melanocytes no do so melanins near more in your skin, meaning say you need the inhibiting components. If it is less, then we will need the stimulating components and not just a joint in echo. Are you getting it?
Yes.
All right, that is fine. That is fine. Okay, so this table is showing you into a bisa say what are the hormones that are produced by the pituitary gland? We have the thyroid stimulating hormone. Okay. Adrenocorticotropic hormone, follicle stimulating hormone, luteinizing hormone, growth hormone, inhibiting hormone for growth hormone, inhibitors for prolactin releasing hormone, and then inhibitors for melanocyte stimulating hormone. Is that okay? If we ask you hormones produced by the pituitary gland, you now have to talk about, the only hormones produced by the pituitary gland is the anterior hormones, is at the anterior part of the pituitary gland. The posterior part of the pituitary gland does not produce any hormone. Into a bisa hormones produced by the pituitary gland, don't talk about oxytocin and ADH. Please keep it in your mind. When we ask you hormones produced by the pituitary gland, do not talk about antidiuretic hormone and oxytocin. When we ask you hormones produced by the pituitary gland, do not talk about antidiuretic hormone and oxytocin. You only talk about thyroid stimulating hormone, adrenocorticotropic hormone, FSH, LH, JH, inhibitors for growth hormone, inhibitors for prolactin releasing hormone, inhibitors for melanocyte stimulating hormone. Those are the hormones that are produced by the pituitary gland. But when we ask you hormones that are released from the pituitary gland, that one you mention all of them, including antidiuretic hormone and oxytocin. Keep it in your mind. When we ask you to state all hormones that are released from the pituitary gland, that one you have to mention TSH, ACTH, FSH, LH, growth hormone, inhibitors for growth hormone, inhibitors for PRL, inhibitors for MSH, including oxytocin and antidiuretic hormone. Please, have you gotten that component too? Have you gotten that aspect too?
Yes, sir.
Sir, please, I have a question.
Okay, ask your question. Please, ask your question.
Sir, please, can you say that the pituitary gland is associated with 8 hormones but producing 6 of them?
Come again.
Say that the pituitary gland is associated with 8 hormones but produces 6 of them.
Oh, that is fine. If that will help you to remember, is that okay?
Okay.
If that is going to help you to remember, that is brilliant. Okay, if that is a step that you are going to take, at least to help you or to guide you to remember that, oh, this is what is happening, is brilliant. Okay, so I hope you've understood this table and what happens in the hypothalamus and then the pituitary gland. Okay, so let's do a bit of exercise. Okay, what gland produces thyroid stimulating hormone?
So the anterior pituitary gland.
Excellent. Yes, so it's the pituitary gland, specifically the anterior pituitary gland. Okay, what gland produces oxytocin?
So the posterior pituitary gland.
Hey, who said posterior? We are using produces. So
Sorry.
Hypothalamus. Okay, which gland produces inhibitors for growth hormone?
So the question again.
Which gland produces inhibitors or inhibiting hormones for growth hormone?
So the hypothalamus.
Hey. A somatotroph cells. Yes. So that inhibits growth hormone secretion. Okay. Which gland produces growth hormone inhibiting hormone?
Repeat the question again.
Which gland produces growth hormone inhibiting hormone?
The hypothalamus.
Okay.
So you said what?
Which gland produces growth hormone inhibiting hormone? Hypothalamus. Okay. Which gland produces prolactin inhibiting hormone?
So the hypothalamus.
Hypothalamus. Which gland produces follicle stimulating hormone?
The pituitary, anterior pituitary.
Anterior pituitary. Which gland produces which gland produces adrenocorticotropic hormone? Which gland produces somatostatin?
The anterior pituitary.
The anterior pituitary.
The hypothalamus.
Hypothalamus. I told you another name for growth hormone inhibiting hormone is somatostatin. Okay. Which gland produces dopamine?
The hypothalamus.
So you said what?
Dopamine.
The
Hypothalamus. What is another name for dopamine?
The
prolactin inhibiting hormones.
You have to know the other names, so please. Okay. Which cell in the anterior pituitary produces TSH?
the
Thyroid.
TSH.
The thyroid. Cells.
Cells will can as a bob break or boas no can come.
Thyroid cells.
Good. Okay. Which cell produces growth hormone? Which cell in the anterior pituitary produces growth hormone? Somatotroph cells. Okay. Which cell in the anterior pituitary produces ACTH?
So the
cells.
Excellent. Yes, excellent. So now I think you've passed the whole hormones of there. So you see, you should know these things off head. If you ask you, okay, mention the hypothalamic hormone, then you tell the person, oh, hypothalamic hormones, they are divided into two. We have posterior hormones and anterior hormones. Anterior hormones are further divided into two. We have the releasing hormones, inhibiting hormones. You get it? You should understand it deeper. You get it? The releasing hormones are the thyrotropin releasing hormone, corticotropin releasing hormone, gonadotropin releasing hormone, growth hormone releasing hormone. Inhibiting hormones are the growth hormone inhibiting hormone, prolactin inhibiting hormone, melanocyte stimulating inhibiting hormones. Okay, then the posterior hormones are two, oxytocin and ADH. The posterior hormones, when they are produced by the hypothalamus, they are sent to the posterior to be stored there. So it's the posterior that rather releases. The hypothalamus does not release. Okay. The anterior hormones, on the other hand, when they are produced, they are released. So the hypothalamus causes them to start working before they go to the anterior pituitary. Okay. And when they get to the anterior pituitary, depending on which hormone it is, it has a specific target cell in the anterior pituitary. Okay. Then you have to know the target cells. Do you get it? You have to know the target cells. If you understand this, then you realize that it's very simple. Is that okay? All right, that is fine. So you see this diagram, this diagram is going to show you how the whole thing looks like. So you see, this is how the hypothalamus looks like. You see the hypothalamus, this is how it looks like. So it produces the releasing hormones, and then we have the inhibiting hormones. So the releasing hormones, we have thyrotropin releasing hormone, corticotropin releasing hormone, gonadotropin releasing hormone, growth hormone releasing hormone, prolactin releasing hormone. Then we have the inhibiting hormones, prolactin inhibiting hormone, the dopamine, and we have somatostatin. And when they all come to the anterior pituitary, they have target cells they are coming to look for. Is that okay? So in the anterior pituitary, we have the somatotroph cells, the thyrotroph cells, the corticotroph cells, the gonadotroph cells, the melanotroph cells. You get it? All those cells are there. So when they come, they have target cells that they are coming to look for. Is that okay? Great. Then now quickly, let's look at the pituitary gland. Let's look at the pituitary gland. What are the other names for the pituitary gland? The pituitary gland is having two other names. What are the names?
The hypophysis and the master
gland.
The master gland. So the pituitary gland, you can also call it the hypophysis gland, or you can call it the master gland. Why do we call it the hypophysis gland? Why do we call it the hypophysis gland?
Because it's located near the hypothalamus.
Good. It is located beneath the hypothalamus. Hypophysis. Is that okay? And you know the pituitary gland is having two anatomical divisions, the anterior pituitary and then the posterior pituitary. Now, because the anterior pituitary is connected to the hypothalamus through a blood vessel, we call it the adenohypophysis gland. Say adenohypophysis gland.
Adenohypophysis gland.
Say adenohypophysis gland or anterior pituitary.
Hypophysis gland or anterior pituitary.
Adenohypophysis gland or anterior pituitary.
Hypophysis gland or anterior pituitary gland.
Because it is connected to the hypothalamus via a nerve fiber, we call it neurohypophysis gland. Say neurohypophysis gland.
Neurohypophysis gland.
Neurohypophysis gland. Hypophysis gland or posterior pituitary. Is that okay? So all that we are saying is saying pituitary gland or hypothalamus acid. And then to a friend hypophysis. You say in medicine you can hypo be a what form. Bibi will form a friend hypo. Okay, so pituitary gland or hypothalamus into a friend hypophysis. And the pituitary gland or two anatomical divisions. Or anterior division, posterior division. Anterior how any hypothalamus connects through blood vessel. Because of that, we call it adenohypophysis. It's another name for anterior pituitary is what? Adenohypophysis gland. Another name for posterior pituitary a neurohypophysis gland. Okay, so I can ask you a question that another name for the anterior pituitary is adenohypophysis gland. Explain. What will be your answer? Another name for anterior pituitary is adenohypophysis gland. Explain why.
Because it is
It's an adenohypophysis gland because the hypothalamus communicates to the anterior pituitary through the blood vessels.
Come again.
So it is called the adenohypophysis gland because the hypothalamus communicates to it through the blood vessels.
That is excellent. Brilliant answer. Okay, another question I can ask. The posterior pituitary is also called neurohypophysis gland. Explain. How will you explain that one too?
That one too. The neurohypophysis because the hypothalamus communicates to the posterior pituitary through the nerves or through a nerve system?
Through a nerve fiber or a nerve. Okay, that is fine. So basically, that is it. Okay, so the pituitary gland is also called the hypophysis gland. Is that okay? Great. And look at let's see how it looks like. So you see, this is how the pituitary gland looks like. Okay. Into the pituitary gland now, we have a part that is hanging. Okay, so you see, there's the hypothalamus. You can see this part that is hanging. This part that is hanging, this area, we call it infundibular stalk. Say infundibular stalk. Infundibular stalk. Good. Or you can say infundibulum. Okay. So you see this part that is hanging. Look at this part. You see the part that is hanging. Say infundibulum. Say infundibulum.
Infundibulum.
Or say infundibular stalk.
Infundibular stalk.
Again, say anterior pituitary down. Anatomically, we've divided into 3. So we have the topmost part. The topmost part, we call it pars tuberalis. The middle part, we call it pars intermedia. And then the distal part, we call it the pars distalis. Into anterior pituitary, miensa 3 anatomical region. Okay. Estrono, your friend pars tuberalis. Your friend pars tuberalis is closer to the infundibulum. Okay. Now the medial part or the middle part, we call it the pars intermedia. And then the downmost part, we call it the pars distalis. But when we take the posterior pituitary, the body of the posterior pituitary, we call it the pars nervosa. The pars nervosa. Say pars nervosa. Say pars nervosa. Now, if I ask you, okay, which portion of the anterior pituitary is closest to the infundibulum? What will be your answer? Which portion of the anterior pituitary is closer to the infundibulum? What will be your answer?
Pars tubularis.
Okay. Which portion of the anterior pituitary is far away from the infundibulum? What will be your answer?
Pars distalis.
Pars distalis. What is the anatomical name given to the main body of the posterior pituitary? What will be your answer?
Pars nervosa.
Pars nervosa. Those are some questions that we can ask you on the pituitary gland. Okay, and again, we can also ask you to state the hormones that are produced by the pituitary gland. What are the hormones? Who can mention the hormones produced by the pituitary gland? Yes, who can mention the hormones produced by the pituitary gland?
Sir, we have the luteinizing hormone, the follicle stimulating hormone, the thyroid stimulating hormone, the adrenocorticotropin releasing adrenocorticotropin hormone.
Okay.
The growth hormone.
Growth hormone.
Prolactin.
Inhibiting hormone.
Inhibiting hormone.
And melanocyte inhibiting hormone.
Yes.
Okay. Don't mention oxytocin
and antidiuretic hormone.
Good. Don't mention oxytocin and ADH. You can't say mention. If we ask you to talk about hormones produced by the pituitary gland, don't mention oxytocin and ADH. If we ask you to mention hormones produced by the pituitary gland, please do not mention ADH and oxytocin. But when the examiner asks you to mention hormones that are released from the pituitary gland, you can now mention oxytocin and ADH. Please keep that in your mind. Okay? All right. That is fine. So quickly, we also looked at the thyroid gland. Okay? What is the anatomical characteristics of the thyroid gland? This is the largest gland in the body. Okay? And we call it the gland of metabolism. The gland of metabolism. The gland of metabolism. What is the weight of the thyroid gland? 20 to 25 grams. Okay. Now, what is the location of the thyroid gland? Where is it located? Where is the thyroid gland located?
Anterior
thoracic vertebra.
Come again?
The anterior to the trachea.
thoracic vertebra, and then below the larynx.
Come again.
The anterior vertebra and the fifth cervical vertebra and first thoracic vertebra.
Good. So first you can say it is at the anterior neck. Is that okay? And then second, you can also say that it is related to the spinal cord or the vertebral column, okay, within the fifth cervical vertebrae and the first thoracic vertebrae. Okay. Also another name for the thyroid
gland. To ask a question.
Yes, please. Ask your question, please. Ask your question.
Sir, please. So if you ask this question and I answered by saying it is located anterior to the trachea, just below the larynx. Okay.
Okay. Oh, it's correct, but it's correct, but don't forget that we can also make the question specific that, if, for example, in an MCQ, we can ask you specifically that in relation to the vertebral column, what is the location of the thyroid gland? We will say, no, your answer will not be valid. Is that okay? That answer will not be valid. Okay, that is why you have to know the two anatomical locations. Okay, yes, and usually when it comes to locating organs, the vertebral column is very important. We use it as a serious landmark when it comes to locating organs. So if you remember very well, when we were learning the kidney, we also learned the location of the kidney in relation to the vertebral column. I don't know if you remember. Yes, so the vertebral column is very important when we are locating organs in the body. Okay, great. Now, how many cells do we have in the thyroid gland? How many cells do we have in the thyroid gland? How many? Yes. Yes. Yeah. What agree about that? Yeah. Two cells. Okay, what of cells?
T4.
Come here. All right. Can you hear me?